In today's video, I'm going to be talking about the best and worst ways to get diagnosed with SIBO. Another way to conceptualize it is the most legitimate science-backed ways to be diagnosed with SIBO and the most absurd, quackiest ways that well-intended but knuckleheaded practitioners diagnosed some of my patients and students with small intestinal bacterial overgrowth. What I've gone ahead and done is drawn us a nice bar graph similar to my SIBO spectrum video. Go check it out if you haven't already. And we're going to be coloring this in red, orange, yellow, and green. On the one end of the spectrum, we have green. These are the best, most scientifically validated, accurate ways that we can diagnose SIBO. If you get diagnosed this way, you can absolutely take that diagnosis to the bank, and it is highly likely to be clinically relevant for you. Underneath that, we're going to have yellow. Yellow is going to be somewhat useful, but not nearly as accurate and not nearly as validated as the stuff in the green. And if it comes back positive, it may or may not be super clinically relevant for you and your symptoms. In the orange category, we're going to have things that are absolutely not diagnostic of SIBO, but at least there's a hint of logic behind their use, so I can kind of give them a little bit more of a pass. And then in the red category, last but not least, we're going to have the things that are utter and complete tosh. Complete quackery that will never, ever, ever diagnose freaking SIBO. Now, we're going to start with the red category, the things that are utter and complete quackery or tosh, but I will make two acknowledgments right out the gate. Number one, all of these are based on true stories from people that I have worked with, so students or patients, and clinical people, like people with degrees and licenses and people who theoretically know things, told people that they had SIBO based on what I'm about to tell you. And I'd like to think that those practitioners are well-intentioned, just ill-informed. So I'm not trying to pick on them necessarily, and I'm not trying to be a judgy Judy. I'm just saying that we need to use our brains here a little bit more. So number one, not throwing shade at any individual, but maybe we could do better. Number two is that I'm not going after these tests intrinsically in and of themselves. So I'm not saying that these tests are universally bad for all things. I'm saying that they are never going to diagnose SIBO. And that is the problem, right? So it would kind of be the equivalent if somebody told you that you had SIBO based on an elevated TSH test. We could agree that that's kind of rubbish, right? There's no way that TSH is going to be diagnostic of SIBO. So that to me would fall into the quackery realm versus something that at least has a little bit more logic or a little bit more gut specificity to it. I would place that more in the orange category. So without further ado, and hopefully people don't come at me with pitchforks for saying some of these things, let's get into the utter tosh, the quackery, the things that have made my jaw frankly drop when I hear these clinically. So again, we're gonna put this in the quackery category. What are the things that will never, ever, ever diagnose SIBO? And it is absolutely preposterous that somebody would suggest this. So a couple come to mind. First of all, I don't even know what to call this one. If you know, put it in the comments below. Actually, for that matter, if you have your own horror stories of things that people said to you to diagnose SIBO, I'm all ears. I would love to read them in the comments. So feel free to comment down below. But I don't know the name of it, but sometimes you'll go to a holistic or a functional medicine office and they'll do this test where they do a finger prick and they get a drop of blood and they put that on a microscope plate and they look at your blood under the microscope, and I think it's called live blood fluoroscopy or something like that. But they look at the blood under the microscope, and based on what they see, if the red blood cells are clumping or if they see certain things in the blood under the microscope, they will give you some sort of diagnosis. I'm not an expert in this arena, but what I will tell you is that that is absolutely not diagnostic for SIBO. And I had one new patient moderately recently who was told that this blood spot testing was diagnostic of SIBO, and she was told with a straight face, see that under the slide? You must have SIBO. Just no. Blood work, aside from maybe antivinculin antibodies, blood work is not going to be specific enough to the small intestine that we can really judge small intestine versus any other body part using that kind of test. Similarly, I had another new patient, or no, this was a FODMAP Freedom student, and she was told that she had SIBO because she had a high level of vitamin B12 in her blood. Now, I have heard the opposite happen. I've heard people be told that they have SIBO because they have low B12 in their blood, and that actually came up more recently with a new patient. And that I would place that more in the orange category. I don't think that that's diagnostic for SIBO, but there's at least some rationale, right? Oh, SIBO causes malabsorption. Therefore, you would be malabsorbing your nutrients, such as B12. Therefore, this might be a malabsorptive case of B12 deficiency. Bada bing. Okay. I can at least follow the logic on that, but I'm going to get to why this is problematic in a minute. But having elevated levels of B12 in the blood, I just don't know what the logic was behind that. Yes, some microbes can make vitamin B12, but to the best of our knowledge, it's not highly absorbed. So I don't think that was the rationale. I really don't know. What I would ask this person is, A, are you taking a supplement or are you taking B12 injections? And if the answer is no to both of those, there is a little bit of a conversation in the functional space that is way too beyond the scope of this video about whether your B12 is making it into your cells. And you could maybe choose a different type of B12 to supplement with, but that's a whole can of worms I can't really get into right now. It's way too long-winded and I'm not an expert in that field. But elevated B12, absolutely not diagnostic for SIBO, never will be, nah. This is the one where the people with the pitchforks are gonna come for me. I'm actually gonna put the oat under here too. I'm not saying that the oat is universally bad. I don't use it personally, but I'm not saying it's the worst test in the world. But what I'm saying is you're not gonna diagnose something like SIBO based on a urine metabolite. So urine is made by blood. Blood circulates through your entire body, and then you filter it in the kidneys and you produce urine. So if there is a bacterial or a fungal metabolite in your urine, we don't know where it came from because that blood has been everywhere. You could have a bacterial or fungal dysbiosis or infection in your colon, your small bowel, your stomach, your freaking lung. We don't know because it's urine. And the whole idea of the diagnosis of SIBO is that we are lasering in on the small intestine. If we just wanted to call it dysbiosis, we would call it dysbiosis and we wouldn't label it as SIBO. So unless you can be really freaking specific that this is a problem in the small bowel, it should not get the label of SIBO. And that is the issue I have with using the oat to diagnose SIBO or SIFO. Can't do it. Now, going back to this orange category. So these are inaccurate, but at least we have an understanding of why that person drew this conclusion, right? So there's slightly more logic. I'm gonna say, I'm too lazy. Inaccurate, whatever. So low vitamin B12. Like I said, the logic behind that is, okay, SIBO can cause malabsorption, including B12 malabsorption. Therefore, if you have low B12, it might be a malabsorptive issue and it might be SIBO. That's the logic, and I understand that logic. However, what I will tell you as a nutritional therapy practitioner and somebody who looks at food diaries an awful lot with my students and patients, I will tell you the absolute number one reason why people have B12 deficiency is because they're not eating enough B12. It's a lack of intake, first and foremost, and the way that you rule out malabsorption in something like this is that you would have them do a food diary, something like Chronometer, which you can do for free, by the way, and you would verify that the person is eating foods with B12. Notice I'm saying foods and not just supplements. You would verify that they're eating plenty of food-based B12, perhaps even supplementing to get a little bit of extra. And if their B12 still doesn't budge, then you could go on the hunt for reasons why they might be malabsorbing it. But here's the thing, you can malabsorb B12 for numerous reasons. If you have pernicious anemia, if you have low stomach acid, if you're using PPIs, if you have undiagnosed celiac disease or Crohn's disease, there are many reasons why you could malabsorb B12. So this in and of itself, with the right diagnostic workup, can maybe eventually lead you to the diagnosis of SIBO, but it shouldn't be your first thought when you see low B12. And that's what happened with this particular patient. Here's another one coming right up on another one that functional medicine loves very much, and that is stool testing. Stool testing, in any way, shape, or form, cannot and will not ever diagnose SIBO. I do not care what the people at GI Map tell you. I do not care what the people at the Gut Zoomer company tell you. You cannot diagnose SIBO with stool testing. They're different ecosystems coming from different parts of the tube. I covered this in a video. I'll try to remember to link it in the description, but there was a video that I did maybe about 2 years ago where I looked at one of Dr. Pimentel's studies where they mapped out the microbiome in the upper, middle, and lower part of the small bowel and different parts of the colon and compared that to stool. And what they found was that stool was mostly reflective of what is hanging out in the distal colon, which means the tail end of the colon. Truth be told, stool testing is not even super reflective of what's happening in the beginning of the colon. The ecosystem changes that much in the span of a couple of feet of colon. And similarly, stool testing is not even remotely similar to what's hanging out in your small bowel in quantity or quality. So again, I don't care what these companies tell you. I know the GI Map has a whole training video telling people how to diagnose SIBO with their fancy, expensive stool test. I don't give a shit, pun intended. This is not scientifically validated. End of story. Come at me. Anyway, last one in this category, and this one's going to severely bum some people out. So I apologize in advance. I know the stool one might bum people out as well. This is the one that's really going to get you. Sorry, guys. Lactulose breath testing also makes it into the highly inaccurate, don't bother category. I have a whole video on this and I explain the rationale, but basically the problem is that lactulose speeds up transit time, and when you get a peak in gas production, it's almost always because that substrate has reached the colon, not the small bowel. About 88% of the time when the substrate when there's a peak in gas production on lactulose breath testing, 88% of the time, that is reflective of the substrate reaching the colon, and it has nothing to do with the small bowel. It doesn't matter if the peak happened at the 60-minute mark, the 90-minute mark, the 45-minute mark, hell, even the 30-minute mark. Lactulose is an absolute crapshoot, and you should not be using it to diagnose SIBO. End of story. And again, I'm going to put the link to that video talking about the science and talking about the research in the description, and I'll try to remember to put a pop-up thing on the screen, but lactulose, not usable, guys. Now, let's change colors of my markers. The story is getting happier, right? Like, we can do this. We're through the hard part. We've had the hard conversations. Now we can get into something that might give us a glimmer of hope. Two things belong in the yellow category. By the way, can we just laugh about having children? Can you see my yellow marker that has been completely, utterly destroyed? This is what happens when you have an 8-year-old and you work from home. She uses my board to draw and apparently destroyed my yellow marker. So I'm gonna write the words in orange, but you just know it's yellow, okay? All right, so the yellow category has two things that are decent. I'm going to say this is the dece category. Number one, we could put glucose breath testing. Now again, the breath tests share a very similar problem in that we don't know how long it takes for the substrate to reach your colon. And therefore, we can't say with 100% certainty what peaks are happening because the substrate reached the colon versus which peaks actually mean SIBO. So it still has problems and it's not perfect, but I would rather take a 50% false positive rate over an 88% false positive rate any day of the week. So I'm going to put glucose in the dece category. Another one that I mentioned earlier is anti-vinculin antibodies. So this is going to be something like IBS Smart, IBS Detects. There's one from Cyrex Labs. There's a couple of different variations of this now, but I usually use IBS Smart. This is basically the autoimmune version of SIBO, or like autoimmune dysmotility. I've talked about it quite a bit on this channel over the years, but basically this is what happens after food poisoning. And antivinculin is like an autoimmune attack against the nerves that run your motility. And there is a high likelihood that somebody with this situation would come back diagnosed with SIBO. It's not 100%, which is why I still have it in the yellow category, but it is going to be far more useful than any of the things in the orange or the red categories. Now, last but not least, oh, actually, there's one more I almost forgot. Last but not least, in this yellow category, we could also say that doing an endoscopy with aspirate and culture, let's see, I'll just say AC for aspirate culture, using a range of 10, hold on, using a range of 10 to the third. 10 to the third is the newer diagnostic criteria. That's what a lot of labs, including Pimentels, are going to be using, and that's what's getting seen in research. But you start to get a lot of false positives when you drop the bar that low. Now, I think that the aspirate is probably still going to be superior to stool testing, lactulose breath testing, or a simple B12 test, but it's not going to be as good as the stuff in the green category when you're using that low of a bar to diagnose this. But it does make it into the yellow. But last but not least, let's answer the question on everybody's minds. Okay, lady, you took away all the things we love so much, so how the heck do we diagnose this rotten condition? And really, the only thing that I'm going to put much of any weight in at this point is an aspirate culture using 10 to the fifth or greater. Now, I covered this a little bit in my SIBO spectrum video, which again has a very similar bar graph to this video, but SIBO of yesteryear, when they genuinely had malabsorption and when they genuinely had all of the scary things you hear about on the internet, that version of SIBO was using diagnostic criteria of 10 to the 7th to 10 to the 9th. And then a number of years ago, we dropped it down to 10 to the 5th, and that might be reasonable too. We might be finding people who genuinely benefit from treating SIBO when we drop it down below 10 to the 7th. But there is quite a big difference when we get to 10 to the 5th, 10 to the 6th, 10 to the 7th versus 10 to the 3rd. Again, we're getting a lot of false positives. We're getting a lot of healthy, normal, asymptomatic people who are diagnosed with SIBO when we use a 10 to the 3rd methodology. And that's why that lands in the yellow versus if we have stricter policies, stricter diagnostic criteria, and only use 10 to the 5th or higher. I think that these are the people who really genuinely have SIBO and would benefit highly from treating it and killing it, versus a lot of these people may or may not see symptomatic improvement when they try to treat that version of SIBO. I know that some of this video was a bit of a bummer, maybe frustrating, maybe confusing. You're probably watching this video because you had a lactulose breath test. That is by far the most common way that people get told that they have SIBO. And now you're thinking, great, well, maybe I do, maybe I don't even have this condition. And if I do, I don't have a good way to monitor it in the future. What the heck do I do now? And that's where hopefully I have a solution for you, whether or not you truly have SIBO. This is the world I live in. This is what I work with all day. The people who maybe have SIBO, maybe don't. Maybe they have IBS, maybe they don't. But the symptoms are the same. Bloating, indigestion, abdominal distension, abdominal pain, crappy poops, pun intended, constipation, diarrhea, mixed bowel pattern. Some of these people also have GERD. Some of these people also have pancreatic insufficiency. Some of them have Crohn's or celiac disease like me. But no matter what the ailment, no matter what the root cause, I can help you get to the root and heal your body and heal your gut and feel better this year in FODMAP Freedom in 90 days. This is my group coaching program. I've talked about it on this channel before, but basically the link is down below if you would like to join the wait list. That's going to be really important because we have to close our doors after a certain point to keep the group intimate so that everybody gets individual attention. So if you want to skip the line and make sure that you get in when we're enrolling again in August, I would highly recommend that you go to the link down below and join the wait list. As part of the FODMAP Freedom experience, I sent everybody little tester baggies with a bunch of different supplements and herbs so that you don't have to spend a fortune on a million gazillion different pills. I know that the functional medicine space and the naturopathic space probably has loaded you up to your eyebrows with pills. And it's not to say that those pills are invaluable or ineffective, it's just that you can't be a happy pill popper person and expect to really heal your body. So we use some pills, but I try to take the financial burden off of you and give you little sample packets to try them out at home. This particular packet that's going out today to one of my FODMAP Freedom students has some HCl, some bile support, and a whole lot of herbal prokinetics for them to try out. But I think that there's more foundational stuff that needs to happen no matter where you are on this continuum. So whether you have honest to goodness, bona fide real SIBO or a maybe SIBO, maybe not kind of situation, I am reasonably sure that I can help you to the point where if you go through my program and your GI symptoms are just the same or relatively untouched, I will give you your money back. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.